Foot and mouth disease. It is also called as aphthous fever or Maunkur, a highly contagious disease which causes vesicles formation on lips, oral cavity, udder and teats. Etiology of the disease. It is caused by aphthovirus of picornaviridae, which are the smallest known virus of animal origin. These are RNA virus and have 7 serotypes A, O, C, Asia 1, SAT1, SAT2 and SAT3. There is no cross-protection between serotypes, which is a big difficulty in vaccine production. Epidemiology. Cattle are more prone to infection, followed by pig, goat, buffalo and camel. This disease is prevalent in Asia, Africa, South America and some parts of Europe. Japan, Australia and New Zealand are free from this disease. A, O, C and Asia 1 are common in Asia, A, O, C are common in America and SAT1, SAT2, SAT3 are common in Africa. A, O and ASIA1 are common in Pakistan, especially O is considered 80 to 88% causing disease. Severity of the disease. Although morbidity can reach up to 100% but mortality rate, i.e. 20% in young ones and 2% in adult cattle, but it causes huge economic loss. Transmission. Direct and indirect contact through different body secretions and excretions like milk, saliva, faces, urine and bull semen. Type is isolated from semen in Pakistan. Mechanically, these are transmitted through human and animals. Through air they can spread up to 250 kilometers, so the animals in the UK can be affected by the viruses from Europe. Pathogenesis. 1. Primary viremia. 2. Viremia. 3. Post-viremia. Primary viremia. This stage lasts for 3 days. The virus enters the body and starts to multiply in nasopharyngeal region, primarily in the dorsal part of tongue and pharynx. After primary replication, the viruses go to the lungs and multiply invasively. Viremia. This stage starts within 1 to 21 days when the virus enters the blood and disseminated to different parts of the body like oral cavity, tongue, teats and interdigital spaces, and causes characteristic vesicular lesions in these areas. Post-viremia. Characterized by recovery of the lesion. It is acute in the case of oral lesions and delayed in the case of udder. Clinical findings. Incubation period is 1 to 7 days depending upon infection load and animal susceptibility. Signs can be: rise in body temperature 104 to 106 degree Fahrenheit, drastic decrease in milk production, anorexia due to acute stomatitis, long and ropey salivation, smacking of lips, lamneys, mastitis and abortion in pregnant animals. Case of death is acute myocarditis. Necropsy findings. Vesicles and ulcer formation on muzzle, buccal cavity, esophagus, stomach, trachea and lungs. In young ones, ventricular wall is streaked by yellow lines. It is pathognomonic lesion. Hairy panther. After recovery from the outbreak, the animals show dyspnea, hairs overgrowth, heat intolerance and anemia. It is due to the permanent destruction of the thyroid gland by this virus. Diagnosis. Made on the basis of clinical history and lab findings. Basic test are VNT, ELISA, complement fixation test, RT-PCR and ELISA. Treatment. No specific, only supportive treatment with NSAIDs, immune boosters and antiseptics. Vaccines are also available like FMD vaccine by VRI. Thanks for watching.